If migraines are stealing your days or your peace of mind, you're not alone. And no, you're not doomed to a life of painkillers. There are science backed natural supplements that don't just dull the pain, they target the root causes. I'll walk you through what I recommend in practice for migraine prevention, brain protection, and long term relief without all the side effects. In practice, I meet a lot of patients that suffer from migraines, and there are many different types of migraines. Some may just have it when it comes to their cycle. Some actually experience something we call status migraines, where they're having it for months at a time. Either way, it's debilitating and can make you not feel like yourself and not really be able to participate in your life. We want to turn that around and really take a better understanding of migraines, apply this holistic approach so that you have a plan moving forward to both prevent and treat your migraines holistically. Migraines are a complex neurological process that really is involved with changing levels of circulation to the various vessels in your brain. That's what causes a migraine. Migraines are different from other headaches. They are throbbing, they are intense. They can be on one side or both sides, and oftentimes symptoms like nausea or even vomiting can accompany them. Sometimes people have to lie down in a dark room for hours or sometimes even for a day to get back on track. Again, when we think about migraines, we want to understand what the triggers are, why this is happening, and then what you can do about it. And sitting with the many patients I have over the years, we understand that stress, a lack of consistent sleep, hormone changes, and certain foods or food additives and even dyes and preservatives are common migraine triggers. For example, we know that when someone is going through a stressful period of time, one of the first places or first signs and symptoms is a throbbing, intense migraine. With hormones, we see migraine triggers all the time, and those could be at various points in a hormonal cycle. For example, some women get migraines at ovulation or as their cycle is about to go into the latter half or the luteal phase. Other women experience migraines more intensely in the latter part of their cycle, right before they're about to bleed. So that's a low progesterone issue. And others experience it at the beginning of the follicular phase, right as they're starting to bleed and estrogen levels are coming up. I've seen migraines at all points of our menstrual cycles, and they are definitely a sign that your hormones are not balanced. Many of my patients will have gone through multiple visits trying to solve their migraines, where hormones oftentimes are the root of it. But in addition to stress and in addition to hormone imbalances, we know that a lack of key nutrients is tied to migraines. Caffeine and alcohol can be migraine triggers also. And then food and food preservatives. Dyes can trigger migraines, certain preservatives can. There are many patients sensitive to things like salt or MSG and additives in certain products, along with environmental changes, barometric pressure, weather changes. All of these can be migraine triggers. So long story short, migraines can be triggered by many different circumstances and conditions and body chemistry, and that gets personalized to you. So as we start thinking about migraines in a holistic approach, I think the first step is to keep a symptom diary to understand, first of all, how frequent your migraines are, what maybe happened in the 24 to 72 hours prior to a migraine attack, and how long does it take your migraine to go away? What did you do on your own that helped that migraine to resolve? And that's really valuable information for any doctor trying to help you with your migraine management. Now, when we start with the Western, more conventional approach to migraine management, it usually does involve an assessment of trying to understand what your triggers are, but then goes usually straight into medication management. There are many different classes of migraine medications, some of which are older, and there are a lot of newer ones on the market as well, but all of them targeting this sort of vascular issue that people have with migraines and trying to bring relief. Now, I'm not going to go into all the different classes of migraine medications on this video, but I've seen everything from Imitrex to sleep medications like trazodone to newer migraine medications like a Nurtec, all being used to help with migraine management. And some patients absolutely do get relief. Most of the traditional or migraine management of medications is usually focused on medications to relieve symptoms or on mindfulness-based therapies like cognitive behavioral therapy. It does sometimes also involve imaging like MRIs or CTs to make sure there's nothing else going on that needs attention. But that's typically what's happening in the exam room. So a patient coming into one of our clinics at Whole Plus who maybe has already gone to a conventional doctor to manage migraines, maybe on a prescription, maybe has had some imaging done, whether it's an MRI, CT, or even an EEG, but usually has not had much more of a deeper dive. They may even have prescriptions for nausea, for pain, things like ibuprofen, or even Zofran might be sort of in their toolbox. And again, there's nothing wrong with that. Those are all appropriate to manage symptoms, but the issue being that we need to go deeper than just symptoms. We need to really understand what's driving a migraine and what's causing it. Now, when we flip the conversation and look at the Eastern models of medicine, they take a different approach to migraines. And again, it's a lot around personalization again, but they connect the dots on migraines, not just being migraines, but actually connected to, yes, your hormones, but even gut function, liver function, and even your stress, overall stress levels, and what might be happening there. So they kind of bring more into it when they're thinking about the root cause. So let me give you some examples. So first of all, in acupuncture, there are many protocols for migraine and migraine management. But here's the super interesting thing that I always found so fascinating. The points for migraine management in acupuncture are actually digestive points. They targeted digestion and those digestive points as a way of managing migraines. So they saw that gut-brain connection thousands of years ago, right? Fascinating. They did acknowledge the issue around hormones and hormone fluctuations and what that does for migraines. So in addition to that, there are many hormone points in Chinese medicine when you're trying to manage a migraine. Finally, they prioritize nervous system control by personalizing your plan and helping you understand again where you needed to focus versus everybody else around you. Now, when we bring both models into our clinics at Whole Plus and we understand that patients need relief, but they also need to understand root cause medicine and they need to have a personalized plan, the merging of these two systems is beautiful and really brings results. So here's what happens if you come in and have a migraine and I have an opportunity to work with you. One of the things we look at is your symptom history. What is the pattern? Remember that symptom diary I talked about. What is the pattern of your migraines? How frequent are they? Are they timed to anything? And anything could be your cycles, as we've already talked about, but could also be, are they timed to you walking into a particular home or work environment? Time to seeing your family, which may be a stressor for you, time to a certain situation or instance. And so we're trying to understand that history. So we're sorting through or filtering through, is it hormones? Is it stress? Is it an emotional trigger? Is it food or is it the gut? And trying to piece and pull that information together. Secondly, we want to understand from a meridian standpoint what your deficit is. If you have a liver meridian issue, then it may be more tied to toxicity and might be tied more to the environment rather than necessarily just to the head or just to another system of the body. Next, we want to also understand what your nutritional profile looks like. Do you have inflammation and what your hormone balance is? If you're chronically low in key nutrients, we know that increases your migraine threshold. Being low, for example, in B vitamins or magnesium are two big triggers for chronic migraines. Magnesium is so critical that I actually say for most patients of average weight, starting around 200 to 400 milligrams of magnesium a night is usually helpful. And again, that's a big generalization, but we want to understand what that right dose is for you. The magnesium makes a big difference. As we move from triggers and understanding kind of your bioterrain, your hormone levels, your risk, and then even your micronutrients, we also want to look at things like inflammation, understanding what your sleep cycles are like. One of the things I think that gets missed over and over again in the Western model is that sleep patterns have to be consistent, right? So many people are technically still getting 7 hours of sleep or 8 hours of sleep, but they're not getting sleep in the right circadian rhythm time allotments. Okay, that's a very important Eastern concept where you should be sleeping between about 10:30, 11 to about 5:30, 6 in the morning. And when we try to flip that, whether you're a night shift worker or you're someone that's a night owl, I hear that all the time, or you're somebody that's just trying to sleep in on the weekend, that alteration in consistent sleep is a huge, huge migraine trigger. So sleep education, sleep hygiene, a big part of migraine management. Next, we want to look at hormones and get into hormone balancing and see if something needs to happen there. And last but certainly not least, there are a lot of natural herbal remedies that help with migraine management. For example, feverfew has been found, that's an herb, has been found to be very helpful in managing migraines, but that's going to be in more active management of a migraine. It's not necessarily preventive. There's something called butterbur. That's another herb that helps with migraine management as well. So many of these natural remedies play a role in controlling, first of all, the frequency, the onset, the duration, and the intensity of a migraine, and really help to bring it down. Now, sometimes you might still need a medication, and that's okay, but that medication dose, again, can be skewed smaller and less frequent so that you have fewer and fewer side effects. So hopefully this gives you a good overview of migraines from a holistic perspective. We could keep adding on to this basic plan that I just started. We could add acupuncture. We could add CBT. We could even add on hypnosis or EMDR if your migraine is actually a trauma response, not a biochemistry response. So in the holistic model, the 5 bodies matter, putting them together and targeting and honing in on the one that's causing you the most stress and distress is really our mission and our motto. All right, hopefully that's all things migraines. Remember, I post new videos every week. Don't forget to like and subscribe.